There is a mystery hiding in plain sight one we face every single day in our grocery stores. It's a mystery that looks simple on the surface but contains a chilling, logical secret at its core. If you walk into any Sukultant dollar bill, you can buy a mountain of processed snacks, donuts, chips, soda that will give you a massive dose of cheap calories. But if you try to buy us in fresh, whole foods like apples, you'll walk away with it that you bought before and your $10 will be gone much faster. This isn't an accident. This is the central paradox of our modern food system. The food that is worse for us is almost always the ball, and that simple is the single greatest driver of one of the most terrifying epidemics of our time. The data is untamable. The United States is facing a crisis of diet-related diseases. Obesity and type 2 diabetes rates have become some of the gravest public health concerns in the nation. We know scientifically that a diet rich in fruits, vegetables, and whole foods is the best defense. These foods are packed with fiber and nutrients that power our bodies and protect our health. In contrast, the cheap processed foods are engineered to be calorie-dense and nutritionally empty, saturated fats and high fructose corn syrup. The mystery we have to solve is this: why, in the wealthiest nation on earth, is the choice to be healthy so expensive? Why does our economic system seem to try to take care of ourselves? To understand this, we have to look behind the price tag on the apples and uncover the strange, invisible forces at work, starting from the very ground our food grows in. The first part of this bizarre puzzle is in the fields themselves. For most of human history, farming was an intricate, labor-intensive process. Today, changed. Consider the humble strawberry, a food essential for a healthy diet. To be sold fresh, a strawberry must be carefully picked by hand at the perfect moment of ripeness. It can't have a bruise, a bump, or any blemish. This meticulous, human-powered work is expensive. The same is true for a head of broccoli or a bushel of leafy greens. These are living things that require delicate handling, a quick journey to the shelf, and an unforgiving lifespan. It's a logistical nightmare that makes fresh partly costly. Now, contrast that with the food that becomes our junk food. Think of the vast fields of corn-side wheat. These aren't hand-picked. These are industrial machines, massive harvesters that roll through thousands of acres, scooping up every last kernel. Bumps and bruises don't matter, because these crops' arms aren't destined for your dinner plate. They're going to factory to be processed into high fructose corn syrup, soybean oil, and cheap fillers. The system is a masterpiece of efficiency, but that efficiency comes at a great cost to our health. But the real horror is not just in the fields, it's in the policy books of Washington, D.C. This is where the mystery of our food system takes a truly dark and logical turn. Because what if I told you that your home government, the one tasked with protecting your well-being, is actively subsidizing the very food that is making us sick? For decades, federal subsidies have been overwinded toward a few select industrial crops: corn, soy, and wheat. These programs were designed to protect farmers and stabilize the food supply, but they have had an unexpected and devastating side effect. By making these crops incredibly cheap, the government has inadvertently created an unfair economic advantage for every single product that uses them. The price of a can of soda, a bag of chips, or a processed snack is artificial because the primary ingredients are subsidized. A bag of apples, on the other hand, not so much. The logic is simple, yet terrifying. The system is literally paying for us to eat less nutritious food. And this brings us to the most dangerous aspect of this whole file, the one that should truly terrify you. The result of this system is as predictable as it is devastating. By making cheap calories abundant, we have fundamentally rewired our relationship with food. Food deserts in low-income neighborhoods where fresh produce is either unavailable or prohibitively expensive, but a fast food restaurant or a convenience store full of subsidized foods is just around the corner. The shocking fun fact is that the economic cost of these diet-related diseases is astronomical. Billions of dollars a year are spent on treating obesity and diabetes, a cost that dwarfs the subsidies that helped create the problem in the first place. This is a scientific mystery where the cause and effect are crystal clear, but the will to change it seems to be off somewhere in the political system. So what can be done to break this vicious cycle? Some researchers are looking at the success of one of the most effective public health campaigns in history, the tobacco tax. For decades, federal and state taxes on cigarettes have steadily increased prices. And as prices went up, per capita consumption went down. It's a simple, undeniable correlation. This has led to an interesting idea of junk food tax. The proposal is to tax non-essential food items like sugary drinks, candy, and chips at the manufacturing level. The goal isn't to punish people, but to use a proven economic tool to steer consumer behavior toward healthier choices, by making unhealthy food even more expensive. The tax would level the playing field for fruits and vegetables and hopefully curb some of the worst dietary habits. A junk food tax alone won't solve the problem, especially since the price of healthy food is still a significant barrier for many. So the most logical path off both sides of the equation make healthy food cheaper and unhealthy food more expensive. We are beginning to see some logical forward-thinking solutions emerge. For instance, programs like the Fruit Investable FFV ARCs are giving doctors the ability to prescribe produce to low-income patients at high risk of diet-related diseases. In this innovative program, patients receive vouchers to buy fresh food, treating healthy eating as a form of preventive medicine. It's a powerful idea that directly addresses the cost barrier. Similarly, community gardens and urban farming initiatives are helping people reclaim control over their food source, encourage eating with minimal financial investment. These grassroots efforts prove that people want to eat healthy. They just need the opportunity and the resources. The mysteries of the modern world are often not about mythical beasts or alien visitors. They are about the strange, illogical set built for ourselves. Our food system is one such mystery, a system designed for efficiency and profit, not for health. It has created a paradox where the choice to live well is a luxury, not a right. The truth is, the tools to fix this paradox are already in our hands. We just need to apply the same logical, scientific thinking to our food supply to add to every other great challenge. This has been another Odd World File. If you are new here and appreciate a logical, nonpartisan analysis of the strange and complex world we live in, be sure to subscribe.